Hi, this is Dr. David Cavazos DC. Today I'm here to talk about the most common cause of low back pain in my practice and most practices. And it's very important to know what causes the low back pain with diagnosis and examination and x-rays initially, and then if you do have neurological signs and foot drop and foot weakness, at that point it's always good to take MRIs for further details on what your problem is. But 90% of the low back pain, their spines look like this, and you could see that in this case the left pelvis is higher and the right pelvis is lower, and that is known as pelvis unleveling. And what that does, it creates problems in this big joint here of the sacrum called the sacroiliac joint. The sacrum is pie-shaped, and it's a weight-bearing joint, and the sacrum connects to the pelvis called the sacroiliac joint. Right now, this spine has unequal pressure, and most likely he is going to have pain in his left sacroiliac joint. And many times this will have a lot of low back pain, pain when they walk, pain when they sit, and they're in a great deal of discomfort when you or the patient presents into the doctor's office. They will present with low back pain many times, in this case left-sided low back pain, or if it's like this, chances are there's going to be right-sided back pain, and this pain is going to be radiating down the leg. Now, there's different reasons for radiation pain into a leg, and it's not always the sciatic nerve. In this case, it's a sclerodermal pain from the SI joint that refers the pain down. So we take x-rays, we see what we have. We do range of motion, we do neurological tests, we take your blood pressure and your vitals, and then we start the diagnosis, which in this case will be pelvic unleveling, left sacroiliac joint disorder, which is determined by the x-ray and examination, including stress testing that we do that will isolate it to the left SI joint. And in treatment, we start with blocking, where we start blocking the pelvis, and as the pelvis is blocked, we level the pelvis, and then we give some pressure into the sacrum and stretches, and always this muscle seems to be very, very tight, and that is the gluteus medius muscle. So what we do is we get a lot of deep tissue to loosen this up, but many, many, many times the pain will be here, and in some cases the piriformis muscle, and we're going to loosen this up, and then we're going to manipulate them. And it's amazing, but you start feeling better usually on the first visit, and typically if it's a very bad sprain where the ligaments connect, the sacroiliac ligaments are torn very well, once you're balanced you start feeling better, and then at that point you're allowed to heal. And I always recommend in this phase where you're having a lot of pain, no bending, no lifting, no twisting. I recommend belts when there's a lot of pain when you're standing, and the belts go around the pelvis, not the low back, and that supports and keeps the pain and pressure off the SI joint, sacroiliac joint. And another thing that's advised is every time you're sitting, you're driving, you're going to the restaurant, there's a lumbar cushion pillow that we also have. And with these inflammatory type pains, we always recommend fish oil. And fish oil has omegas, and omegas are anti-pain, anti-inflammatory. But it's not that hard. I have been very successful doing this for over 30 years. And I hope you stop in our office, Dr. David Cavazos DC at 66 North Avenue, Carroll Spring, Illinois. And my phone number is 630-915-3600. Thank you for investing your time with us today.